My name is Dr. Stephen Gabel, and I am a diplomat of the American Board of Hair Restoration Surgery, or otherwise known as the International Board of Hair Restoration Surgery. In order to become a diplomat, a candidate must meet the required prerequisites and training. Once the credentialing committee confirms that a candidate has met the standards, the candidate is then able to take a comprehensive written examination and a clinically based oral examination. I want to expand on the oral examination. The oral examination is administered on specific dates, usually during the International Society of Hair Restoration Surgeons World Congress. Sometimes it is administered twice a year. We meet in a designated room with the candidate and 2 or 3 highly experienced hair restoration board examiners who are diplomats also of the board, who will score the candidate on their performance. The candidate is presented with a case, which one would usually encounter in a typical hair restoration clinical practice. The candidate acts as the physician, and one of the examiners will act as the patient. The examiner, who is the patient, will present to the candidate a complaint about hair loss. And it is up to the candidate physician to ask questions and take a thorough history and perform an examination just as they would in the clinic. The candidate needs to be very thorough with their questions and their assessment. They will be given any information they desire or ask for to help make their assessment, diagnosis, and treatment plan. But it is up to the candidate to ask. Ultimately, the candidate will be asked what is their diagnosis and what is their comprehensive treatment plan for the patient, whether it is medical treatment, surgical treatment, or both. The examiners will be asking in-depth questions to assess their knowledge of the treatment plan and how they manage any adverse outcomes or complications from the treatment rendered. It is important for the candidates to understand that the language and the words that the examiners use are very scripted and uniform for all of those taking the examination that day. This is to ensure that all of the candidates are presented with the exact same scenario, the exact materials, and the exact verbiage so that it is fair for all the candidates taking the examination that day. We do not want one candidate to have an upper hand or an advantage over any other candidate. It needs to be fair across the board. Our goal is not to confuse or trick the candidates. Our main goal is to ensure that individuals who are diplomats of the American Board of Hair Restoration Surgery possess the knowledge and experience to practice hair restoration that is clinically sound and safe for the patient. A lot of time goes into developing the oral examination questions, and before it is administered to the candidate, the entire scenario is scrutinized word for word to make sure the exam is fair for all and that the scenario is unbiased between examiners. The examiners are trained in how to administer the particular examination and how to respond to the examinees. Again, our goal is to administer a challenging examination, but a fair examination for all. The candidate will receive the results as either a pass or fail a few months after it is administered. My recommendation for a successful examination is to first have a deep knowledge of the practice of hair restoration surgery. This will be done through your everyday clinical practice, as well as being well read with textbooks and the current literature on hair restoration and hair loss. For the oral examination, there are several excellent videos on the ABHRS website that go through practice scenarios, so one will get a feel of how the exam is administered. I also recommend the Advanced Board Review course, which is given each year at the ABHRS World Congress meeting. I hope this gives you insight into the oral exam process. For me personally, I studied very hard for the examination, and I learned a lot, which ultimately made me a better, well-rounded physician taking care of my hair loss and hair transplant patients. I wish you well in your journey in becoming a diplomate of the American Board of Hair Restoration Surgery. Thank you.